This lecture is about the respiratory system. We will start with some basic anatomy. We will then pass on to major respiratory diseases and conditions. Later on, we will talk about history taking and focus on the basic questions you will need to ask your patient if you suspect a respiratory disease. We will then focus on A&P, that is to say auscultation and percussion, and learn the basic terminology regarding breath sounds. We will end this lecture mentioning the main diagnostic tools and treatment procedures. Structurally, the respiratory system consists of two portions. The upper respiratory system, which comprises the nose, the pharynx, and associated structures, and the lower respiratory system, which refers to the larynx, the trachea, the bronchi, and the lungs. The respiratory portion, where the exchange of gases occurs, consists of the bronchioles, alveolar ducts, alveolar sacs, and the alveoli. Now let's look more closely at each part. The nose. The nose has an internal and an external portion. On the undersurface of the external nose are two openings called the nares or nostrils. The bridge of the nose is formed by the nasal bones. Up the nasal bones there is the frontal sinus. Down the larynx, the thyroid cartilage of the larynx is also called the Adam's apple. The epiglottis is a large leaf-shaped piece of elastic cartilage, and the glottis consists of a pair of folds of mucous membranes. The lungs are enclosed in two serous membranes called the pleura. Each lung is divided into lobes by one or more fissures. Now I suggest we pass on to the most common diseases that may affect this area. Rhinopharyngitis and laryngitis are both inflammations due to upper respiratory infections or irritants. The trachea, the bronchi, and the bronchioles can be affected by diseases and conditions such as asthma, bronchitis, and bronchiectasis. Among various diseases affecting the pleura, we can name pneumothorax, where the pleural cavity is filled with air, hemothorax, where the pleural cavity is filled with blood, and pleurisy, which is the inflammation of the pleural membrane. Now we're going to focus on lung diseases. An acute infection of the alveoli and the most common infectious cause of death in the US is pneumonia, a condition in which alveolar walls disintegrate, producing abnormally large spaces filled with air during expiration, is emphysema. The presence of a blood clot in a pulmonary blood vessel that obstructs circulation is called pulmonary embolism. An inherited disease of secretory epithelia that affects the airways, pancreas, is cystic fibrosis, a condition in which the respiratory system cannot supply sufficient O2 to maintain metabolism or cannot eliminate enough CO2 to prevent respiratory acidosis is called respiratory failure. An abnormal accumulation of interstitial fluid in the spaces and alveoli is called pulmonary edema. Now, let's focus on the abbreviations that are used in this field of respiratory system. For instance, COPD, which stands for chronic obstructive pulmonary disease. SARS stands for severe acute respiratory syndrome. TB stands for tuberculosis. RDS stands for respiratory distress syndrome. And WC stands for whooping cough. Now I suggest we pass on to history taking. When you suspect an ENT or a lung disease, you will need to ask specific questions. Let's see what they are. Smoking. Do you smoke? How long have you been smoking? How many packs a day? When did you stop? How long did you smoke? Dysphonia. Do you feel hoarse? Dyspnea. Are you short of breath? Difficulty breathing. Do you find it difficult to breathe? Cough. Do you cough? Is it a dry cough or is it a wet cough? Phlegm. Do you bring up any sputum? Do you bring up any phlegm? Hemoptysis. Do you cough up blood? Fatigue. Do you feel more tired than usual? Cachexia. Have you lost any weight? What's your appetite like? Dysphagia. Do you have difficulty swallowing? Pain. Do you feel any pain in your chest? Do you have a sore throat? Once you've taken the history, you will need to perform a physical examination. Let's have a look. Physical examination starts with assessment of the general appearance. Discomfort and anxiety, body habitus, and the effect of talking or movement on symptoms all can be assessed while greeting the patient and taking a history. Inspection should focus on signs of respiratory difficulty and hypoxemia, signs of possible chronic pulmonary disease, such as clubbing, chest wall deformities, abnormal breathing patterns, jugular venous distension. Now let's focus on A and P. First, the instructions. Could you breathe in and out for me, please? Would you mind taking a deep breath and holding it? I'd like you to cough. Could you say 99 for me, please? During this A and P, you may hear sounds like snoring, stridor, wheezing, rhoncus, rales, and crackles. At the end of the A&P, you will probably need to perform more tests. Among the diagnostic tools, you can order blood gases, measure carboxyhemoglobin, do a pulmonary function test, perform oximetry, order a sputum culture and sensitivity, and tuberculosis tests. You can also make a chest radiograph, perform a lung scan, and a bronchoscopy. As for treatment procedures, let's name 2 current treatments such as oxygen therapy and lung lobe resection in case of lung carcinoma. And as for medications, the most widely used classes of drugs are decongestants, cough suppressants in case of a dry cough, expectorants in case of a wet cough, bronchodilators, and corticosteroids in case of asthma. Thank you for your attention.